So moving on, OTs, as I said, we are very, very keen and concerned about the environment. And we believe that the environment plays a major role in a child's life, especially if they're autistic. Because really you have to look at it as if the environment is actually the main building blocks. And I will say this as well, if we have some parents, which I know we do on the forum, always bear in mind that the first point of contact that your child is going to have in terms of their life and their world experiences is first going to come from you before they go out to the world. So really there is quite a big onus and a big responsibility on the parenting side as well, to view your child as special, to view your child as a blessing, and to also see that child as being able to add value to your family setting as well as the wider community, and to not see your child as something of shame or of guilt, so that you really have a positive mindset to give that child the best upbringing that you possibly can. As well as that, as parents, looking at the different provisions of education that you have around, because some parents may prefer, you know, to send their child to a mainstream school, but we have to look at the child's needs. Can the child really manage in a mainstream school? And can the mainstream school actually meet the child's needs? Because some specialist schools, they have a broad range of services and expertise that your child would actually probably benefit more from in a specialist school than a mainstream school. Then having said that, you have those that, like she rightly highlighted, what we call high functioning. So if they're high functioning and actually academically they're quite gifted, they would even blow some of the kids out in the mainstream. They're actually mega geniuses. There are many examples of that, of those that are autistic, that actually work in really serious high profile IT jobs and coding, where they're left alone in isolation, but they're really doing great work and impacting greatly on the society and actually developing loads of things. But the environment must foster that growth, because the environment can be at a significant barrier as well if the community, and especially if the families, are not accepting and actually in support to building and accepting what the situation is on the ground, and actually working with it and identifying the strengths and weaknesses and building those strengths. So the environment really is the foundation for which a child builds upon. I just want to show a quick video. The video is called ACEs. I'm going to stop sharing my screen quickly. Shall I be able to show that video if I stop sharing? I can't hear you, Shola. I think you're on mute.
Sorry, yes, I'll get it up now.
Okay, lovely, thank you.
Okay. Give me a minute. You have things planned nicely and then it goes pear-shaped. I hate technology. Oh, let me see. I'll go in here. Let's see what's... is that the one I want? Okay, okay. So you want, do you want the
ACEs one.
The ACEs one. Okay. Just need this to go away. It's annoying me now. Ah. I'm sure if it's this one.
It's at the top. I can see it on your top link.
It's right. This drop down thing for Zoom is covering my view, so I can't see. So it's not that one. I think it's the one next to it. Actually, I think it's this one here. So let this just go away. Then, oh, come on. Can I move this away? Oh, good. Here we are. Can you see it now?
If you can put it on full screen.
Yeah.
Yeah, we can see it.
Yeah, can you see it now?
Yes, we can. Lovely.
My parents don't understand. All the drinking and fighting means I'm scared. I'd like a cuddle, perhaps a bedtime story, but mostly I'd like them to stop shouting at me. And sometimes they hit me. Feeling scared every day and not feeling loved or wanted will change me for the rest of my life. Later, I'll have problems at school, problems with alcohol, and I'll get in trouble with the police. What's happening to me right now means I'm more likely to have serious health problems in middle age and die sooner than I should. Doctors say my life is full of adverse childhood experiences, or ACEs. But in my world, this means I see my dad hitting my mum. Dad's got a drinking problem, and mum's always crying, even with the tablets. I am always being shouted at and hit. After the booze and fags, there's not a lot of money for toys or clothes, or even food. I'm getting used to being scared all the time. Now I'm just angry. Doctors say things are changing inside me. My brain isn't learning how to control my feelings properly. My body can't relax like those kids who don't have ACEs, so my body won't be able to repair itself properly when I get older, making it more likely I'll get cancer or heart disease as an adult. It hurts when my parents hit me, but the real damage is hidden, and that damage will be with me for life.
I drink and smoke. They say I'm out of control, but I'm not. It's just my way of coping with my ACEs. I've been in plenty of fights, but what's wrong with that? Kids' punches don't hurt half as much as when my dad hits me. I beat up a kid last week at school because he looked at me weird. Who cares? I ended up with more time out of school. Learning's not for me anyway, and the teachers don't care any more than my parents. I don't like the way anyone looks at me except my girl. She's 16 and pregnant, just like my mum was with me.
So this is where I've ended up. I've got diabetes and cancer's probably on the way. I know these kill you, but I couldn't do without them. I've never had a proper job and I've spent time inside. I hate my kids. I hate their mum too, until she left, so my kids have grown up with ACEs. And now my daughter had her first kid. She's 16. The course of my life was set in the wrong direction a long time ago. I know where I'm heading, and sadly I know where my kids are heading to. This doesn't have to happen. A little help in childhood makes a big difference to where life takes you. When I was a baby, the nurses noticed that my mum wasn't coping and helped her and explained how important my childhood is to the rest of my life. So, with a bit of help, she coped. The police came round after next door complained about the noise from mum and dad fighting. They asked how I was feeling. I told them I was scared all the time. Mum and dad got help. The shouting got better and the hitting stopped. I even got some bedtime stories. I still had problems at school, but the teacher asked me about what was happening at home. I got help controlling my feelings. It wasn't a lot, but it was enough. I'm now married with 2 children, and I've got a job, most of the time. I haven't repeated the same problems with my kids. We got help when being a parent got too much. Our children are ACE-free, and that means their kids stand a good chance of growing up ACE-free as well. Almost half the people in England and Wales experienced one ACE as a child, and 1 in 10 of us suffered 4 or more ACEs. If we stop ACEs, millions of children would not become smokers or binge drinkers, and levels of violence in adults would be cut in half. Fewer ACEs in childhood also means fewer adults developing diseases like cancer, heart disease, and diabetes in middle age. We all need to be ACE aware. Are you? Doctors, police, nurses, teachers, firefighters, and most importantly, parents. The more you know about ACEs, the more you can help stop children growing up with ACEs in their lives. And for those of you who have already suffered ACEs, the more you know, the more you can help yourself and others who have suffered ACEs cope.
So Joyce, stop that now, yeah? Okay, yeah. Unmute yourself, unmute.
Yeah,
Okay.
I'm back. So the reason why I played that video to you guys, ACEs, is just to highlight the importance of ACEs. And really what that is the emphasis on the environment. Because as you can imagine, even children that are not autistic are subject to being raised in environments that don't foster growth. And actually what that means is that the foundation, we can then predict where the child is going to end up as an adult. If the environment that the child is raised in is not, fostering their well-being or fostering good quality of life, and there's a lot of issues going on around the home. Now, taking that in the context of a child that's autistic, that has maybe not much verbal communication and is not really getting much love and is not getting the opportunity to actually have a good foundation, you can imagine some of the how devastating that is going to be, and the negative impact that is going to have on the child's life in future, meaning that they might not even amount to anything, although there is immense virtues and wisdom and strengths and abilities in that child. So the emphasis of that really is to hone in that the foundation is key. You must not get that confused at all. The foundation is paramount for building the blocks and actually allowing the child to have a better future later on, which is what we hope for, to build a good foundation and actually see our children flourish and have a good upbringing and amount to something. Now, bearing in mind, when we are looking at children that are autistic and even children that are not autistic, we always need to bear in mind, as professionals, as people in the community, as parents, that we need to always have a strength-based approach. And what that means is that the care is holistic. And what we mean by holistic care is considering the whole person, all the needs of the child. So although I know, like in some African homes, there's a great emphasis on education, which is absolutely fantastic. But bearing in mind, if you have an autistic child, the goal should not always be education, simply because there are some children that are autistic that are not actually intellectually inclined. So you could be setting the child up to fail and also causing quite a lot of frustration if you don't identify the child's limitations and strengths and interest on time. So if I take you back to an example, for instance, Shola's son, Jesse, is absolutely a wonderful boy. Now, because the parents have been able to actually identify his strengths and given them the opportunity to explore those, as you can see, he's won amazing medals in gymnastics. Now, who would have thought, oh, maybe he was good at gymnastics if he didn't have the opportunity to actually engage in such activity. But obviously you can see that there's been attention to detail from the very grassroots, that the parents have identified that actually this child is very, very strong on his gross motor skills. It has it maybe has quite good strength in terms of his vestibular movement, in terms of his coordination. And actually he likes that movement, and they've been able to identify something that he actually loves and allowed him to then become an expert in it, to the point that although he is autistic, he's extremely gifted and able to actually use that as a strength to have a good quality of life. So I need to emphasize that when you're looking at the whole person, that is the whole perspective, because there could be something, a hidden gem inside that child that needs to be brought out and nurtured and facilitated, and it might not always be academic. Now, on the other hand, you might have an autistic child who may not be able to do gymnastics or is not very sport inclined, but is extremely acute intellectually, can write novels, and actually might not be able to even talk that much, might not be very verbal, but might be able to, you know, write novels, do like, you know, coding, develop softwares and all sorts of things. But the foundation needs to be right to foster that growth. Hence why the aim and outcome is always about facilitating well-being as a priority. Well-being is paramount. Well-being is paramount to health. So when we're talking about well-being, well-being doesn't mean the absence of a disease. It doesn't mean the absence of an illness, and it does not mean the absence of a disability, because you might not even have a disability, you might not even have a disease, but you might not have a sense of wellness in yourself or a sense of fulfillment in your life. So hence why well-being is a state of wellness, meaning that that person is being allowed to flourish and actually, you know, engage in their strengths and develop as a person, and hence that is their contribution towards society, and not feeling isolated or excluded or feeling ashamed, but really actually having a sense of good sense of worth and high self-esteem. This is me, this is who I am. So when we're looking at children that are autistic, a strength-based approach is very important, and considering the whole needs of a child. There are emotional needs, there are physical needs, there are spiritual needs, there are social needs, and there are mental needs. And just putting all of those into content of the person that you're dealing with. Each person is an individual, and each person is special in their own right. Now, here comes the big word sensory. Now, within occupational therapy, there has been a massive sort of specialism, if you like, and takeover in what we call the sensory needs of a child or person living with autism. Now, as a pediatric occupational therapist, we use the sensory element really as an avenue to sort of relate and communicate and meet the needs of an autistic child. Now, this is really, really important because we use what we call a sensory integration approach. And what that really is that using sensory integration as an approach, it helps us to understand how the brain organizes the sensory information. And also it helps us to understand the relationship between the brain and the behavior that we are seeing. As well as that, it helps us to understand that the brain is filtering information from the environment that is coming in. So some of you might know the 5 senses, because, you know, we all have senses. I'm sure you're probably thinking, going through in your mind, what are the senses that we have? And I'm sure first and foremost, the 5 main senses are going to come to your mind. Now, these 5 senses are very important because it's how we communicate with the world. It's how we perceive and receive information. Receptors receive information from the environment, and it also is a stimuli. So it then, from what we're receiving from the environment, we then produce a reaction. So for instance, if I was going to say to you, good morning, Shola, Shola would respond to me, good morning, Joyce. However, if I was going to say good morning to an autistic child, I might not necessarily get a good morning back. And that is showing you that the sensory needs of an autistic child is different, meaning that the way in which they are perceiving and receiving information from the environmental stimuli around them are different. And that's why it's very, very important to identify the sensory needs in order to meet the needs of these children. I'm going to go into it in more detail. So when I was talking about the 5 senses, I'm sure some of you would automatically identify hearing. Then we've got sight, which is vision. And then we've got touch, which is also known as tactile. And we've got taste. We also have smell as well. But with the sensory integration, we also have identified that actually there are some additional senses that come up in the whole sensory integration. And that is what we call vestibular. And the vestibular is what is connecting from the inner ear that helps the young person or the person with autism to actually have balance. And then we also have proprioceptive systems, which also provides another way of sort of time and space, body awareness, spatial awareness in time and in space. So the senses really, they keep us informed about what is happening outside of our body, and then our body is responsible for them, you know, receiving those information and actually making sense of the information that is received from the senses. So with the proprioception, it's quite interesting because actually, in order to make sense of body awareness and spatial awareness in time and in space, the body actually receives sensations from the joints and from the muscles to make sense of where your body is in time and in space. As well as that, it allows the autistic child to know the position of their body without looking. So some of the tactics we have used to identify if there are proprioception issues is if a child, maybe if you ask them to draw their face, and maybe they draw their nose up here and they draw their eyes down there, it's showing that there's proprioceptive issues with where things are actually located and where they're actually identifying where they are. As well as that, just to elaborate, the vestibular, which is found inside the inner ear and actually sends information to the brain regarding balance, movement, muscle tone, and coordination in regards to the eyes, the head, and the body. Now, with the sensory area, there are differences. So you do get some children that are actually sensory seeking, and you also get some that are sensory avoiding. And what that really means is that the body looks for input where it lacks. So I'm going to go into that a little bit more further. So sensory seeking and avoiding, what that essentially means is that when the sensory input is upsetted or is confused, the child has a potential to be overwhelmed. And what that means is that the child may actively avoid situations and have emotional outbursts. As well as that, when the child does not register enough stimulation from the environment, it may seek it out by consistently moving, humming, flapping and rocking. And what that essentially means is that the brain is sending a message that actually is not receiving enough of that input and stimuli from the environment. So essentially what the child then does is start to seek that out, and that's what we call sensory seeking. Hence why some of you might have seen that there are some children that are autistic. When they are actually overwhelmed by the environment, some of them have the tendencies to sort of hide away. They hold their ears or they rock. It's because their body's struggling to filter the environmental stimuli that is being received that's being received by the brain from the outside world. Hence why, if the triggers are not identified in time, autistic children are prone to emotional outbursts and find it hard to emotionally regulate themselves. So moving forward from that, some of the common sensory triggers that sometimes trigger children that are autistic are things like tags on clothing, things like seams in socks, things like rough fabrics, food textures, loud noises in the environment, sudden outbursts of noise, very strong smells, bright flashing lights, and really fast-paced environments, as well as grass and dirt. There are loads of triggers, and so that hence why observing the child and knowing a child is really, really important to actually managing the breakdowns and also the meltdowns in the first place. So some of the reactions that you might see when it sort of reached the child's peak in terms of the reactions are things like spitting, biting, hitting, kicking, shaking, rocking, hiding, punching others or self, chewing, walking around frantically, and crying. These are some of the reactions that you're getting to identify that actually something's not quite right at the moment, and it's showing you that the optimum level of well-being is actually currently off balance, because that's their way of expressing that something is not quite right with their systems. And hence why the sensory integration part is really, really, really important. As well as that, often children that are autistic, they have sensory processing disorders. And what that means is that the body finds it hard, as I said, to filter the environmental stimuli. And you might see, this might present in various ways, such as children that are autistic might not like brushing their teeth or combing their hair, because the actual stimuli that it is actually occurring on them is actually that is very, very uncomfortable, because it might be that the child is very sensitive to touch, and or a combination of sensitive to touch and sound. So brushing the hair, it is actually heightening those two senses of touch as well as sound. So some children actually combined hypersensitive to the senses. It might just not be one, it could be a combination of 1, 2, 3, or even all of them. So you can imagine how problematic that can be, going into unfamiliar areas where it's not being managed well. Some people might not actually like being tickled or being touched or being hugged, and that is showing that they're again sensitive to touch, and they might actually resist hugging. That's showing that they have sensory needs. And some children actually might chew on their clothes. They might chew on anything that they see, it goes in the mouth. And really, that's another form of what we call sensory seeking. So the sensory seeking in the tactile side is the fact that there's a constant urge to sort of chew on things. And after they've chewed on those things, you start to notice that actually it helps to then regulate them afterwards. As well as that, some of them might have very poor gross motor skills in terms of like riding bikes and things like that. They might have very poor fine motor skills, issues with handwriting, issues with cutting things as well. And these are some of the things we look at as part of providing therapy goals to helping children with, because obviously handwriting is quite important to engage in learning in school. And then obviously, as you've got here, I'm overly sensitive to loud sounds. So imagine a child who's hypersensitive to sound and walks into a classroom, and then maybe they've got another child that's pulled their chair out and that squeaks. They've got the teacher wiping the board. They've got the door that just slammed. They've got somebody rustling papers in the background. As we're able to actually, our body can filter those sounds appropriately and actually then have selective hearing, which then channels in the focus of what we need to be focusing on at that particular moment. But actually, for an autistic child, they actually are already hearing 10 times of one sound. So you can imagine multiple sounds or stimuli in the environment then interacting. That's what we call then having an overload. And that's when they then have the potential to then, have meltdowns, biting themselves, scratching, because they're literally showing you that the environment is not catering to their needs at the moment. It's providing an overstimuli according to the needs that they have at that time. So interventions that OTs can put in place are things like sensory circuits. So we put things in place like sensory circuits, and what the sensory circuits essentially mean is that it helps the nervous system to become more organized and regulated, and this comes in 3 stages. So when we do a sensory circuit, we usually do this in the morning. We call it wake up, shake up for children that are autistic. And what that means is that the first stage is alerting, so you're waking up the body senses. The second stage is allowing the nervous system and the brain to organize the body systems in order to bring it back down to the first stage, which is calming. And then that stage, when the child is then calm, which is applying deep pressure and calming relaxation activities, the child is then able to engage in whatever activity they need to do. It is not possible to engage a child in any activity, whether learning or their hobbies, when they're dysregulated. You've lost it at that point. That's why it's very, very important to identify what their triggers are from the onset with a good screening checklist and assessment base, because then we know what the needs are. We know how we can manage the needs in different settings. As well as that, we put in, as I said, checklists to identify the sensory needs. We put in sensory diets, which is an array of activities, functional and very practical activities that can be done in school, in the community, and at home, and by parents and by families and loved ones that come in contact with the child that's autistic, but they know exactly what to do and how to do it in order to meet the needs and to identify the triggers and to manage environmental stimuli that can be quite upsetting for an autistic child. As well as that, we consider transitions. So transitions is something that is very anxiety provoking for a child with autism, because transitions basically means moving from A to B. That could be going to the toilet. That could be going to the door. That could be going out of the house. That could be going from one room to another. It could be a transition, just moving from one point to another. Now, for a child that is autistic, that has quite intense sensory needs, anxiety, managing transitions and unpredictability is a very, very big factor. That's why you will find children who are autistic actually like consistency, because it helps them to be able to predict what is coming and manage the level of anxiety and actually prepare themselves mentally for what is coming next. We also do things like sensory boxes. So the sensory boxes are a way, they mimic the checklist and the assessments that's been already prior done. And what that means is they're sort of like a small sensory box that can be carried anywhere, in the car, in the school, in the home setting. And when they become anxious, they can use the activities inside the sensory box to then manage the anxiety and the sensory needs wherever they are. So it's something that we provide generally for them to carry around with them. Sensory toys and fidget toys is quite popular, especially in schools, especially for children that are movement seeking and they're constantly fidgeting. And you quite find that it's quite common with children that have autism, as well as a combination with ADHD. They go lovely together. I mean, they've really got a lot of energy. So you've got to be very spot on with your sensory circuits, as well as the fidget toys as well. And then obviously, we, as I said, we provide the practical sensory input in the diet. We also, as OTs as well, what we also provide is sensory room development as well as management. Now, sensory rooms is something that can be developed at home, in a bedroom, just identifying few needs, and they can actually be set up in a bedroom as well as in the school setting. Usually it's something that you would need an OT to do, to identify that based on the screening and assessment tool of the actual sensory needs on the onset. And then it's sort of easy to sort of, you know, manage as you're going along. Then the environment is a very big aspect, as I said. So some children require low arousal environments. The environment is not conducive when it's too busy. There's so many things on the wall. There's so many things going on. There's flashing lights everywhere. It's actually a trigger for some children that are autistic. Now, deep pressure and calming. Some of you might have heard of weighted blankets and weighted vests. These are actually very, very calming activities. And what they do, as I said, is the last stage of the senses, of actually that comes after organizing the senses. And that actually allows the child to re-engage into the activity or learning. And then another key thing is bespoke timetables, now and next. So a lot of times, some of you that might not have worked in schools or specialist schools, in specialist schools, one of the key things that we always do as OTs as well is help to design a bespoke timetable, because children that are autistic, they like routine. They respond well to consistency. They respond well to things that are predictable, knowing what's coming, what's happening now, and actually what's coming next reduces their level of anxiety, and also reduces the potential for them to have breakdowns as well as meltdowns and emotional outbursts. So it's really, really important. Now, these bespoke timetables are best when they're visual, especially where there's limited, verbal communication, because they can see in picture, and they can actually, they know what's coming next. In fact, they prepare themselves for the transition for what's coming next. So that's another way of you managing the sensory needs. As I said, they like consistency and predictability, and so they need to have a good, tight routine. A lot of children that are autistic don't like things that are just flung sporadically. So if there is something that comes up unaware in a routine, you need to communicate that as soon as possible and start preparing them for the next stage. Otherwise, you could be liable for a meltdown if they don't know what's coming next. Another thing that we have done as OTs as well is, in a school setting, we might actually identify that the needs are quite high in terms of the sensation to sound. So what we might actually recommend is actually this child, before going into assembly, needs to go into assembly maybe 15 or 20 minutes before, or go into the lunch hall to eat lunch 15 or 20 minutes before. Because imagine that the array of noises and sounds can really cause a significant emotional meltdown. So these are sort of what we look at, how we're going to manage these things in stages and at what time. And then also sensory breaks are very, very important. I can't emphasize that, whether at home, whether at school, in the community, whatever task the child is doing, always ensure they have adequate breaks to allow for the sensory outputs and inputs to help regulate the body systems back, so that they're constantly, you know, not under stress or experiencing that anxiety, but actually it's being managed well. So if you've noticed that maybe the child that's got autism can focus for a period of 10 minutes constructively, then you know that's your window. After the 10-minute period, let go. They need a break, because if you keep pushing them, it's not going to be good. So you have to identify what is the maximum capacity that this child can go to, of where they then begin to disengage. They then begin to have meltdowns. You start to see the triggers. They're shaking, they're biting, you know, they're repetitive, saying the same thing over and over again. They're getting anxious, they're frustrated. The behavior is communication. There's something we're missing. Now, moving forward, I've called the next slide around the globe. And really what that means
Wait,
is...
Joyce, sorry. Can I come in? Do you want me to show the other video now, because that's sensory circuit, or not?
Oh, yes, please, actually. Yeah.
I knew you were going to need that. All right. Okay, here goes. Share screen. Here. No, that one. I think it's here. Okay, this one here. Can you see my screen now?
No, we can't see the screen.
You can't see the screen. Okay, so what have I done? Let me go down and choose. Oh, I chose the wrong screen. Sorry. Can you see it now?
Yes, it's about to show up now.
Yeah? Can you
Yes,
see it now?
we can see it now.
Okay, so Joyce, I'll play this now, the sensory circuit video. So it kind of incorporates some of the things that, oh, in fact, not some of the things, all the things that Joyce was talking about that, you know, the children need. So here we are.
Wake up, give yourself a shake up, get your body moving. Reach up, jump up, give your friend a thumbs up, it's another new day. Wake up, give yourself a shake up, get your body moving. Reach up, jump up, give your friend a thumbs up, it's another new day. Get your feet dancing to the beat, get your body moving. Raise a shout, get your feelings out, it's another new day. Wake up, give yourself a shake up, get your body moving. Reach up, jump up, give your friend a thumbs up, it's another new day. Wake up, give yourself a shake up, get your body moving. Reach up, jump up, give your friends a thumbs up, it's another new day. Get your feet dancing to the beat, get your body moving. Raise a shout, let your feelings out, it's another new day. Get your feet dancing to the beat, get your body moving. Raise a shout, let your feelings out, it's another new day. Get your feet dancing to the beat, get your body moving. Raise a shout, let your feelings out, it's another new day. It's another new day.
Okay. Oh, there's more, sorry.
No, it's okay, you can stop there.
I can stop it, okay. I just wanted to say quickly before Joyce carries on that I think you can't overemphasize the importance of what you've just seen there, of you know, the what's going on in that sensory circuit clip that you've just seen, because it helps the children to really regulate their senses. I actually put that together also in the school that I'm currently working, so we can get all autistic children first thing in the morning, and also just before they go home as well, because some of them come in the morning and they are overly anxious already. So we just make sure they go straight into the hall to get on with the sensory circuit, and then they kind of, you know, they're able to regulate themselves better, and then they're back into the classroom. And having said that, even for parents, there's some things there that you can adapt. You know, that ball that you see the children jumping up and down on, I've got one in my room here, well, in my living room here for my son, for Jesse. We also have a mini trampoline in the house, as well as the mega huge trampoline that's, you know, that's in the garden as well for him. So you cannot begin to imagine how beneficial this is for our children. So I keep quiet. Joyce, I leave you. Carry on.
Thank you. So yeah, thanks for that, Shola. Like Shola was saying, it's very, very important, and hence why you know, the activities, as I said, can be done at home, they can be done in school. You know, you have the sensory boxes, you can do them while you're in the car. And the main aim really is to identify that actually majority of children that are autistic do have sensory needs. And if they're going to be engaging and going out into the world, which they will be, there has to be a point in time at which you're finding these strategies to sort of manage their emotions, to help them, you know, regulate their emotions, and actually allow them to be able to engage in the world without constantly feeling anxious or have experienced anxiety, or you know, because at the end of the day, that will help them back from doing the things that they need to do. So it's very, very important to actually get that on board. I mean, with the sensory side, it's absolutely a massive and in-depth area. So I am aware that if there are any OTs on board here and really want to start embedding that in their practice, it is probably something that I would have to, you know, take at another time in terms of the assessment tools that are used and in-depth types of interventions that can be used. But for the purpose of this, it's just basic strategies that can be used both at home and in the school that helps regulate the child's senses and helps them to be able to engage in any task. And you can do that at home. You can have lots of things that you can do, wall press ups. So as I said, with the circuits, they come in stages. So alerting, organizing, and calming. But calming always comes last, because what it does is it sends messages to the nervous system to bring the systems back into alliance, into balance, so that they then can focus on whatever task you want them to do. Because you can't focus on a task when your body is dysregulated. That's the whole idea, because your body is not in sync and it's not comfortable with itself. So it's just all these strategies really, although they're very simple, practical tactics, but they have physiological implications, and they're actually communicating. It's like inputs, they're communicating back to the brain to then help the body to then regulate itself and interact with the real world. So moving forward around the world and environment, the reason why I've put this here, because I know that there's some debates about Western concepts. That do Western concepts actually really work in non-Western societies? And some of the debates are due to cultural differences and environmental differences. You know, some children that maybe are not in Western societies might not necessarily have much choices. And the reason why I've put this here is because we're going to be going on to Shaylee's slide next, who's going to be talking about the cultural aspect and how that links with children living in Nigeria with autism, and how the environmental factors how if it actually has a play. But one thing I want to say that still remains consistent regardless of where you are is the fact that well-being is paramount. So whether you're in Nigeria, whether you're in the UK, whether you're in the US, whether you're in Africa, because I was made aware that there are also some people tuning in from Ghana, there's some people tuning in from other parts of Africa as well. You have to bear in mind that well-being is paramount. So regardless of where you are, the aim has to always be about well-being and actually improving that child's quality of life. Another thing is that environment is a collective effort. So it starts from the mentality. So if you are on here today, maybe you don't have a child that's autistic, or you're not necessarily a professional that works with children or children that have autism, you might be a neighbor to somebody who has autism. You might meet somebody that has a child with autism in a supermarket. You might know of somebody in your church, or actually work with somebody who is autistic. And the reason why I've placed that emphasis that environment is a collective effort is that we all have a responsibility to manage and educate ourselves of how we want to see people. And we must always choose to see people how we want to be seen ourselves. And that is with dignity, that is with respect, and also respecting that everybody is different and everybody is human and everybody has their unique talents and gifts. And if we can start by having an attitude and a mentality in that way, that we all have a collective responsibility to view people with respect and with dignity, then it starts the ball rolling. It helps. It puts everybody on the same level plate, meaning that regardless of whether you have autism or not, you must treat everybody with respect. And if you see somebody that does have autism, make sure that you're well informed of how to sort of relate with them, to deal with them, you know, be very, very respectful and be sensitive to the situation on the ground of what some of the parents are actually dealing with at home. And also encourage a good community support. So wherever you are, you know, some parents that have children with autism, they find themselves sometimes isolated because of the shame and because of the guilt. So by the way you respond to somebody's child can give them the confidence to bring that child out again. So just bearing in mind the way you are treating people, the way you are relating with people, and knowing that everybody that comes in contact with you, you are leaving an experience in their heart. So always hold that as a responsibility in yourself to shape your mentality of how you view people with respect and with dignity, because that could be your daughter, that could be your son, that could be your sister, it could be your neighbor. So as a community, we'll work to one good, and that one good is for everybody to live in a community where they feel safe, where they don't feel threatened, and where well-being is the paramount aim and goal. And remember that behavior is always communication. Thank you.
Can we all give Joyce up?
Joyce, thank you.
Joyce, are you done?
I'm done. I'll stop sharing.
I was really enjoying that. Thank you very much. Thank you so much, Joyce. That has been, I don't know, I can see the thing clapping there. Those people who are hiding behind their videos, how would we know if they're clapping now? Eh? Okay.
You can hear our voice. Thank you, Joyce.
Great. Really.
Yeah,
And thank you.
Well done, Joyce. That was
Thanks,
fantastic.
Okay, I think the thank yous is becoming very prominent. Thank you. Thank you, Joyce.
Thank you, Mr. Good.
Thank
you, Mrs. Ogule, for putting up this. It was, in fact, it's been awesome.
Thank you. We haven't finished yet. You're going to get, you know what I've decided to do also now is, I hope Joyce and Shay, you won't mind. I've tried to write the questions down, but because we don't have a separate chat place for questions, so people have been chatting with me privately as well as asking questions privately. So what I've done is I've tried to write some down, and then I'm just going to read those. And then for some people whose questions I wasn't able to write down, we'll just ask them to unmute themselves when we get to that point and ask them to ask their questions themselves. Because there's some valid questions there that I've seen, and it's just be a shame to not give you that platform to be able to get your questions answered. One thing I have to say that I did notice in some of the chats before we get to Shay is the fact that some parents, just like we said, why are we having this forum? Some parents are actually saying that they've never actually had any significant input, if any at all, of autism in the lives of their children. And their children are now, 10, 12 or older, so that's why it's so important that you understand, or we understand as a society, as parents, as carers, as society, how important occupational therapy is for our autistic children. Now, the one thing that I want to bring out of this, because there's a lot to pick out of what Joyce said, I'm only going to hang on to one. And that one is, I wrote it down here. She said, the child's environment can be an enabler or a barrier, and that is just it. If your child's environment is a barrier, then God forbid, but be ready for anxiety, be ready for depression, be ready for all those symptoms and behaviors that Joyce was showing you, and part of what Sheyi also talked about earlier, the kicking, the biting, the spitting. I see a lot of autistic children, even in this country, and I've seen many in Nigeria too. You just see that look of confusion over their faces, looking sad, looking depressed. You move near some of them, they flinch because, God knows what they've been going through at home with the heating and what have you. And that ACE video, I have to say, was fantastic, because that ACE video cuts across. It's not just for disabilities only. It's for your children who are neurotypical, but then more so for our children who have special needs, our autistic children who can actually verbalize, their feelings. I know that when I raise my voice sometimes in the house, and if Jesse's around me, before I look back, he's run away, he's gone. Because he can't stand, he can't stand. Why is this woman, why is she talking this way? So I quickly, kind of regulate myself and regulate my voice so that, we don't get him all confused and unhappy. So yes, your environment is either an enabler or a barrier. And an environment can be a barrier to our children, down to, family values and understanding, or the society in itself. So it's a collective responsibility. So thank you, Joyce, for that, for what you said there. So I'll stop, and then we'll go to Sheyi. Sheyi will round up for us about autism in Nigeria. I think she's looking at one or two things to do with cultural perspectives, if I'm correct. And thank you everyone for still being with us. I think, judging by the comments and in the chat, I can see that many of you have found this session quite valuable and informative. So thank you very much for your patience. I did say 2 hours, but we're going past that now, and it's but I think it's well worth it. Okay, over to you.
Yeah, yes. Thank you, Shola. Thank you everybody for waiting up to this point, for listening. Thank you, Joyce. That was amazing. And then I'll be very brief. I'm going to spend about 5 to 10 minutes at the maximum, to just look through, bring it down. Let's bring what Joyce has said. Let's bring it to our context. Let's bring it to Nigeria. So yes, I know people will be asking, I'm in Nigeria, and she's talked about central circuit, she's talked about accessing occupational therapy services. Do this really exist in Nigeria, or is OT something that is just Western? Yes. Are there occupational therapists in Nigeria? Yes, there are occupational therapists in Nigeria. There are nearly 100 licensed OTs, all over the country. And then I think that should be good news that, you can get care for your child. And, something like this actually exists in Nigeria. OTs have been in Nigeria for decades, but there's been, just say for a while, there were not so many, because many of the ones we had were trained from the UK and all around the world, and they got older and left. But now there's a lot more OTs, coming in and all that. So yes, where can I find an OT? You can find an occupational therapist. Well, that's the difference. We're still growing, but we're here. So many tertiary hospitals in the Southwest, in fact, I think literally every state, you would have an hospital that has an OT working there. I work with Federal Medical Center, Abeokuta. We have an OT practice in the hospital. I know about Osut as an OT, that's Ogun State Teaching Hospital. And in Lagos, in Luth, well, they used to have an OT department there. But I know that, so you can just ask around, this hospital, or if you ask the physiotherapists that work in any hospital, because we usually, rehabilitation professionals licensed by the same board. So many of them will know where and how you can, assess an OT. And there's quite a number of OTs that are in private practice. I'll be leaving my details at the end of this session. So if you want to have access to an OT wherever you are, just send me an email, I'm in Abakaliki, and then I was wondering where, I could get an OT. We would do the linking up. We OTs are very connected in Nigeria. We kind of have a way of knowing which of this other person is and how they can cover for you. So if you want private practice, if you want hospital-based, and then yes, I you can always just put down my details and send me an email. So yes, is OT a regulated profession in Nigeria? I just talked about, being regulated in the UK. Yes, it is. Nobody can just rise up and say they're an occupational therapist. You have to have a license to practice. And it's given by the Medical Rehabilitation Therapist Board of Nigeria. It's a government agency that regulate occupational therapists, speech therapists, physiotherapists, and prosthetists and autists. So yes, nobody can say they are autists. You don't learn OT. You have to have a license to be an occupational therapist. All of what Joyce is saying are high-end things. Yes, you can apply a lot of this to your children, but it's best when the OT assesses your child as an individual and your environment and all of that, and then they prescribe a particular diet for your child. So you're not just doing trial and error. Probably, your child, some child. You may think your child is sensory seeking at a different time, and then maybe what he really needs at that time is just something to calm him. So what the OT would really work with your child to help understand the unique and perspective needs that your child has and be able to help you. So yes, it's a regulated profession. So nobody can tell you that I learned OT from somewhere. That's why I'm saying this. You don't get the quirk. You don't put your child in the hands of somebody who doesn't know what they are doing, and they're going to harm them further and confuse your child further. So yes, which schools train OT and at what levels? So yes, in Nigeria we have couple of universities that train OTs, one in Ife, and then there's another one that just started in Ondo State now, University of Medical Sciences, Ondo. They train OTs, but primarily it is Ife, and Unimed is just starting. And then there's also a diploma school in Lagos that trains occupational therapy assistants. So that's different. So the university trains, licensed OTs, and then the diploma school in Lagos trains occupational therapy assistant. So the OT assistant is sometimes implement treatment plans for an OT. So the OT, the OT assistant should not work independently. They should work being supervised by an OT. So those are the two levels of occupational therapists we have. So you would see an occupational therapist ideally. The OTAs help to implement the children plan planned by an occupational therapist. So those are the different levels. So you can always ask anybody that says that an OT, there's a reason for this education. Where did you train, and then you figure it out that, oh, this person really doesn't know what they're doing, or they're claiming to be somebody else. So yes, you can verify an OT on the board website. There's a database of licenses, although sometimes it's not up to date, but there's quite a number of names, on that database there that says that, I'm an OT. But if anything, just always send me an email, any name. I would look for a way to, to find out if the person has a license, or the other. So that should be it for our practice in Nigeria. So yes, looking at Nigeria, cultural perspectives to autism and barriers. We all know that there's poor knowledge and understanding. So expect people not to understand your child. Expect people not to understand your neighbor. Expect people to ask, funny questions as to why that is. But it's just because of the level of ignorance, that there is here. So it's your turn, as a caregiver, as a teacher, as somebody on this that doesn't, have a child with autism, to educate people out there that, my child is just special, is neurotypical, and this is what you need. Expect the teacher in school, if he's not going to, most teachers in Nigeria don't have training. So the child is having to go to mainstream school, you be the one to educate them. Those are some of the cultural barriers you would have. Then also there's a lot of people tend to think it is caused by, its possession, spiritual possession, it's possessed by demons and spirits. Please, let's demystify that. God has put knowledge. I'm a Christian, and then I'm religious. God has put, the knowledge that people have now in helping children with autism, I believe was put there by God. He allowed us to have this level of knowledge and supporting this very special people, do you understand, to cope in life. So that's why they are here. And you'd be surprised that a lot of people with autism are very talented. They are the programmers, they are the ones, making inventions, that they want doing things. So these are just special subsets of people that God created. And then if you understand them, then you can live with them and help them to thrive. So do not think, when if he's having a meltdown, it's just, the demons have come. Just see it as what it is. This is a meltdown. There was a trigger to this, and this is how I truly treat it. Do not beat that child saying that, wherever you are coming from, you would go back there. It's only going to confuse. So imagine someone that has sensory problems, that has autism, and then you are beating, you are doing all of that. It's just going to go back into his shell. It's going to end up more confused. It's going to end up disoriented and worse off than before you started. So please, let's just understand autism. There's been a lot of autism awareness, but it's not just awareness, it's also a major goal of this is to help people to understand autism. Then also there's a stigma that, is also in our culture. Everybody expects people to act a certain way. There's a normal expectation. This is normal. This is how normal people behave. If you are outside of this bracket, you are abnormal, or you are stigmatized. So you are now the advocate, everybody here. You are now going to say that, oh, it's just, he just has special needs. He just has this. He just, it's just different. It's just his own style of learning is just different. He just has this need, to calm down at different times of the day. He has sensory needs that are different. Then we also over-expect. Joyce was talking about education earlier. That when it comes to children with autism, education, he may be high functioning and he may not be. But he has, talent. He has areas. If you look at JC is a gymnast. If Shola, stays on education for JC, she would never have found that, that is a gymnast. She had never allowed him, to try out his talent, saying that this one, and that's what we do here. He has not finished studying his books. He has not finished reading. He's going to go and, he's going to play again. That's the problem. So please, let's balance our expectations of these children and just allow them to be themselves. There's need for expectation balance. When you expect from a child, they are going to confuse him further. They're going to, and you rob him of what has been placed on the inside, the talent that he has. You're going to not let him to thrive. It's about thriving. Joyce said it's about well-being. It's about, quality of life. So when we look at these things, education is just one angle of it. A lot of people here, got big degrees in school and they're doing something else. They're doing, and they're thriving at it. So let's just look at it from that angle. Then also there's a social culture, that we have of, you should talk to me, you should go. So that's the barrier to somebody that has autism. He's expected to act in a certain way. He's expected to see you and kneel down. He's expected, we Nigerians or we Africans, we have an exceptional social body. So I want to say that if you understand autism and where the level of social expectation you have from somebody who is autistic, maybe they should be very balanced with their familiar with, but when you don't go, overburdening them with just be able to understand. Then also another burden and barrier I'm going to say, we all know is money. Here in the UK, I'm sure, the government pays for a lot of these services. The schools, the autism schools, the parents are not bringing money from their pocket. But we understand that here in Nigeria, we have to pay for these services. At this point, I can just say, look for the services that are free. Look for places like this, look to reach out to somebody. Autism may not be free, but but there are hospitals that give OT. In those hospitals, the government is subsidizing the fee for having the OT. So if it's possible for you to access an hospital close to you or to access help, in a cheaper place, you can just always compare and see, within what you can afford. And I trust, I know that where there's a need, how do I put it? Where you want, if you really want something, many times you will get it, even if you don't have money. Yes, so, and I'm not going to stop at the barriers. I'm going to talk about the enablers. There's a lot of enablers in our culture. There's what we call Ubuntu as Africans. It's our sense of loving each other, of our sense of caring for our neighbors, is an enabler for people with autism. So it means that if you and I understand autism, and I have a neighbor, in the UK, I'm sure you can't just go and play with your neighbor anyhow. For example, I had to put my daughter at my neighbors for this session. It's not in a lot of places, that you get that. So where people can understand autism, and then we look at our culture, look at how we care for each other, look at you looking out for one another, then yes, Ubuntu will be an enabler. It's something that will make us better rather than enable autism, rather than, be a barrier. Then also early intervention, now that now that children can access OT services earlier, is an enabler, is something that will help them, before they shut down, before they shut out the old world, before they become, you can identify their sensory needs early, and you reduce meltdown. She said Jesse has never had a meltdown because he's learned to self-regulate himself very, very, very early. He's learned to have the right help he needs on time. So early intervention is key. Anyway, as soon as the age is not, when can I bring my child for OT? As soon as you're suspecting, as soon as your child has a diagnosis of autism, then you can send that child for early intervention. Then yes, there's now increased awareness of autism in Nigeria. Many years before now, it was something we didn't hear or think of. There's much awareness. And then that is an enabler. Then also we had the Disability Act passed by the president very recently. I hope that states will step it down and then, you know, would do something about it. Yes, that would be a big enabler when that happens, or that has happened. Then also there's a great number of OTs and OT schools and centers, you know. Few years ago, there weren't so many. I wasn't working with FMC, you know, there were few OTs in Nigeria. Now, more and more each day, we're having more people set up their practices, you know, more centers. So I think that's also an enabler. The advocacy program for it was a train the trainers program, you know, social workers, OTs, physiotherapists, what have you, special education needs teachers in Nigeria. And it was an eye-opener. We got to learn hands-on. So more and more of the CPDs are happening in Nigeria. And I hope that in the near future, it will be bigger. So if there's a governor's wife here, or a governor, please here, do advocacy where you have, and help us to, you know, increase the empowerment, you know, on autism.
You never know. The first lady might be watching you right now, actually, for Ogun State, because she knows this is happening today. Oh, anyway, let's carry on.
Good. Yes, good. Yeah, and this is the future. The future for autism in Nigeria is bright. There's going to be more diagnosis. It's not going to be less because people are getting more aware. You know, we're also on the 5-8 mortality is reducing. So, and that means that children who normally, you know, may not have thrived are thriving. But that comes down with, children who then have special needs. So the future may bring more autism, you know, awareness, more diagnosis, and then it means that we would do not to use the barriers to stop at the barriers and have, you know, pursue quality of life and well-being.
Okay. Thanks, Shay. Thank you. Thank you very much, Shay. Thank you for that. I hope you were able to get one or two things from what Shay talked about there. Thank you so much. Thank you very much. It's what you two have done today is just invaluable. You can't put a price on it, to be honest. So thank you very much. Thank you so much. Now we have time for some questions. And I've written a couple, then I got fed up. So I've said some people, we just get them to read out their questions. I'm sorry, that didn't sound professional. I'm sorry. So anyway, the first one actually was, the first one is, how do we get hold of Joyce? Now the answer to that will be at, I've got a slide that I will share with everyone that has our details on, or better still, all of you now have Justice Place Foundation's email address. So if you email me, I will email you her details with her permission. I'm sure she doesn't mind because her details were actually on the slides. I also had the same question for Shayi as well. She's already said where she is. You would always find her at FMC. She's a prominent person in there. I've been in there before as well. But you can email me if you don't have her details and let me know. But I have a feeling a good number of people here today also are from Shayi's camp, so they know where to get her from in case they need to talk to her about something that we've talked about today, or get in touch with myself, or get in touch with Joyce. Now, there's a key question here, and I think I'll give that question to Joyce. It says, do children lose their diagnosis or do they recover? I feel like answering that, but I think, let me give that to your expertise. It says, do children lose their diagnosis? Because I have a perfect answer, but I want you to answer first.
Yeah, no. Children that are autistic, they don't lose their diagnosis. So once they have been diagnosed with autism, as Shayi and Shola said before, that it's not curable. So it is a condition and it is to be managed for life. So once you have autism, that is you. You're a unique person with autism and it is to be managed for life. However, how you manage autism as we've gone through this today, and the foundation that is laid for the child will depend on how they flourish or not. So they don't lose, but in terms of maybe the recovery area that you're talking about, do they develop? Do they grow? Yes, they do develop and they do grow, providing you give them the opportunity and the foundation and the right environment to flourish and grow. Definitely.
Yes, and that's a perfect answer. That's a perfect answer. I mean, my son is he's developing, he's getting better. There are some behaviors that are much better than before. He can sit. I mean, at church before, it was a nightmare. He can't sit still. He would run up and down. Everyone in church knows who Jesse is, And but now you've got someone who goes into church and is ready to sit for 3-4 hours, provided when we're talking about enabling environments, provided he's got his noise blocker that he wears over his head to block out, you know, some of the noise, because, you know, Pentecostal church, be ready for the drums and the dancing and the loud hallelujahs and what have you. And he's ready for that, but he has his headphones on or he has his noise blockers on, you know, depending on what he wants. So I don't think children lose their diagnosis or recover, but I think it gets better and the behaviors get manageable and, you know, they improve, you know, so yeah. Okay, now there is...
Angela, I want to say that if they don't have support on time, you know, their way of self-regulation may be harmful.
Yes.
And it could be.
Yes.
So if you just leave it to time alone, you know, without support, you could get the child that, you know, when his sensory sick, he bangs his head on the floor and, you know, does all sorts of things. So yes, with support and all of that, yes, I just wanted to add that.
Yes, and it's like what you said. It's what you said also before, Shay. Early intervention is important. It's key. You know, that's one of our phrases in the autism world. You know, early intervention is so important. Okay, now I have another question here that says, do you know if there are any OTs that specialize in sensory integration, either physically or virtually, for a 10-year-old who had sensory difficulties, which is impeding their progression? Remember, we said if some certain aspects of occupational therapy is not set properly in the life of an autistic child, they can't learn. So this is a typical question about that. You know, they've got some sensory integration problems, so they're not progressing as far as education is concerned. So it says, do you know of any OTs that specialize in sensory integration? So I have a feeling that this person is probably asking this question from Nigeria. So, and like Sheyi said, there are people that you can get, that Sheyi can get people in touch with, but also the person also said physically or virtually. So virtually, Sheyi has a consultation. Sorry, Sheyi is about to have a consultation, you know, with FMC. We'll talk about that one later. Joyce has a consultation, and you can always contact Joyce virtually as well. So you have a choice.
I am trained in sensory integration. So
you are trained in sensory integration.
Sensory integration is a postgraduate route for occupational therapies that specialize in pediatric special educational needs. So, yeah.
Okay, so you've got your answer there. So you will have to contact Joyce, who can then give you some, you know, some information and advice regarding that. Also, I have another one here that says, how do we help children who have had enough, especially with signs of being overwhelmed? I mean, Joyce, you could answer that. I can also answer that, but you can answer that.
Yeah. So when you
touched on it earlier, actually, you did.
When you're talking about signs of being overwhelmed, before the signs, there will be the triggers.
Mm-hmm.
So what's happened is that, as we discussed, behavior is communication. So there is something that is being missed before the child becomes overwhelmed. We need to be able to identify what the triggers are in the first place. So it just means that maybe there's some things that you're maybe missing as a parent that you probably haven't noticed. There's actually a trigger for your child. So you just need to find out, one, are there particular times when they tend to be triggers? Some children tend to be quite heightened, some are more heightened in the morning and calmer in the afternoon. Some are very heightened in the afternoon and calmer in the morning. Are there particular days or patterns that you're noticing when maybe they're not really at their optimal best and they're not that balanced? So what I would say is make a record. If you write it down, then you can visually go back and start to make sense of it. So if you start to notice a pattern, write it down. What time and for how long was you noticing it for? Was it before they were asked to brush their teeth? Was it certain foods that were spiking it on? Was it clothes? Were they trying to pull off their clothes? Was it maybe sensory to touch? Maybe they didn't want their shoes on, their socks on. Have a look at the small details. There are always going to be signs. You just have to be observant and identify the triggers. There's always triggers before being overwhelmed.
Yeah. Thank you, Joyce. Well, you know, I think I've just discovered here also that I wrote the name of the person at the top, and I think I kind of shortchanged them with their question. I didn't write the entire thing. And that person was Titi Layomi Fakorede. I can see you, but I'm not sure if you're with us still. Titi Layomi, are you there? Hello? Okay, I think her video is on. But I can only see her picture. But
I think she needs to unmute.
no, well, okay, can you unmute yourself, Titi Naomi, if you're still with us? Because I can see you, but I don't know if you're still sitting down and listening. No? No, she's not. She's because I think that's
I'm sorry, was that my name? Was that my name?
Yes, it was your name. Because
that was so timely. I'm so sorry. I wasn't with my laptop.
Okay.
So
Because you had a question about being overwhelmed, but I knew that question was a bit longer.
Okay, yes. Thank you so much. So my question was actually when, I'm sorry, I'm out of breath. I ran to my laptop.
Oh, that's right.
It was when Joyce spoke specifically about how you can see the signs that this child is overwhelmed. You know, he's either biting or he's just so unsettled and everything. So my question was, because for the longest time, my son has been in therapy for occupational therapy, but then the sensory diet is just something we haven't been able to nail. And I have no explanations for that. I mean, we've worked with a variety of practitioners, but we just haven't been able to nail it. And so my question now is, we might be in situations sometimes where you actually can just remove yourself instantly, or you just can't leave that place at that moment. Or, so let me give an example. In the morning, we need to get out of the door and go to work and go to school. And then that's when this little guy is just having this moment, and you can see that he's clearly overwhelmed. So in such situations, how do we help him? Keep in mind that you just don't have the time to halt that activity, or you don't have the opportunity to remove yourself from that environment.
Okay, Titi, I think Joyce and Shay, can you listen as I try and answer this?
Yeah.
Because from an educationist perspective, and also from a parent's perspective. Now, you've said there might be little issues there for, you know, when you're trying to get him to comply. The one thing you've done there is you've actually identified some of the problems. So for that, I believe you can actually do what we call a social story for your young man. So something like, you know, like in the mornings, you know, he doesn't like to get out of the house to go to school. You have to explain what why school is important and why he has to leave the house at a certain time. But there are ways you do that with social stories, with pictures and very simple sentences. And you repeat that to him, you know, quite often. He might appear to you as if he's not listening or interested, but trust me, he's listening. So when you put your social story together, you're talking about his actions and the impact of his actions on others. But you have to explain it in a way that is so simple, so simplified, with pictures as well. Less words actually, and more pictures, and you talk him through that. And I found that has been quite helpful with my son in the past. You know, when they tell us in school that he's done something and, you know, he does it repeatedly, maybe to annoy another child in the school. So we put a social story, the school put a social story together and said, look, this is what we're using with him at school. So can you use the same with him at home? So don't call Gerard's name more than once. Leave Gerard alone, because when you do that, Gerard gets upset. So you see what I mean? If you go and Google social stories, you'll see that there's quite a lot that you can do with that. So I'm not sure am I on the right path there, Joyce?
Yeah, I think you're definitely on the right path. And I would say another thing is that you can incorporate social stories are absolutely fantastic. It's something that's used quite often. And all it is really is just describing what is happening using picture forms to describe a situation. So it means that maybe where they would get a bit confused or lose focus with things that are quite lengthy, you'd use pictures to describe that situation. Another thing you can do is develop a now and next board, which is what is replicated in the education setting. Mm-hmm. And what that means is that they know what they're doing now and they automatically know what is coming next. Mm-hmm. But you need to have a transition period. So what I would say is, if you've identified that maybe going out is the issue, that's already the clue. So your child is showing you that there is a difficulty in the transition from the house and leaving the house. Is he triggered by noise? Is he triggered by the smell? What is it that is triggering him from that transition? and balanced and calm to a state where he's showing you that the anxiety is increasing. So he's already shown you where the problem is himself. It's just that, just a little bit more attention to detail. Another thing I would say is that if you're traveling maybe by car, or if you have the opportunity to travel by car, if he likes calming music, or there's particular things that he likes as a distraction, it's also something that can be used. So identify what his interests are. There are a lot of children that are autistic that love music. If you music to him, maybe that would also provide another intervention quickly to bring down the anxiety levels before getting to school. Another thing you could try is, if you're not going to be going in a car, you're going to be walking to school, there are something what we call ear defenders, which filters and blocks out the excessive noise from the environment that autistic children find difficult to filter naturally from their brain. So you can try two of the options. But I feel like if you can get the now or next right with the social stories, making sure that transition is really, really smooth, and then also incorporating the child's interests while traveling will then help to lower the anxieties, because you've already identified where the issues are with the transition. It's basically with the transitions, which is very, very common with autistic children. Moving from point A to point B, there's a change.
Thank you, Joyce. Thank you. I think that's Titi, does that help?
Thank you so much.
Yeah,
Thank you.
Shola, I just wanted to add that you know, some of these devices that that have been talked about, they are not so far-fetched. You know, don't start thinking, where can I get them? Many of them are on Jumia. You know, just put it on Jumia.
Exactly.
You would
yes.
be able to order that. You can order ear defenders. They are accessible. They are, some of them are in your environment, and then you may do your own little, and then I don't have this in my immediate environment. How can I step it down for my child? How can I sort of provide a variety of that? And I think that works.
Okay, thank you. Now, Folake is here. Folake had a lengthy question. Folake, you had a lengthy question, and I thought it's best if you asked it yourself. Oh, look at her, ready. She's unmuted herself. There you go. Folake, we can't hear. Oh, we can't hear you. Or is it just me?
We can't hear her.
No, we can't hear you.
I don't know.
Oh.
Hello?
Yeah, hello, yeah.
Can you hear me now?
Yes, we can, yeah.
Okay, all right, thank you. Good afternoon, everybody, and thank you for the lovely session. My question is, so my daughter is 12, and up until now, we've never really had an OT. I can't remember, so it must be that we've never had an OT. And from the lecture that we've had today, I feel like it's something that will be very beneficial for her. So my question was just that, where will be the best starting point if we wanted to consider this, or will there be an assessment, or how do we go about involving an OT in her support?
Okay, Joyce, do you want to answer that? Because Folake is actually from the UK. She's here.
Oh, lovely. If you're from the UK, that would be quite easy to get interventions involved. What I will do is I'll leave my at the end, and if you can contact me so I can know a bit more information in terms of what borough, where you currently reside. I don't want to ask you that live on here, what borough you reside. I'll be able to point you in the right directions and just find out the particular needs. If you want something more privately done, I'm happy to assist you with that anyway, because I do consulting. If you'd like to go via the local authority and access additional funding, I can point you in the right direction. But there's readily a lot of support and resources in the UK. So we can discuss a bit more about that afterwards, simply because of the sensitivity of some of the information you'll be given. I don't want to say for the purpose of where you live and things like that. So if we can discuss that afterwards, that would be fine, if you don't mind.
Okay, so I'll give you, I'll send you Joyce's details.
Okay, Auntie, thank you.
Okay, and also, I think we just have, we'll round up by maybe 10 to 3, about 20 minutes. Tommy C. Onobanjo had a question. I hope she's still here. I looked at the question, it was a bit lengthy, and I thought maybe she might just explain it to us herself. Tommy C. Onobanjo. Are you here or are you gone? I can't see them in front here, but I know there's another. Let me check the other slides.
Okay, hi, good evening.
Oh, hello.
It's actually he.
He. Sorry.
Yes.
Sorry.
Okay, so mine wasn't a question, it was just a suggestion. So I'm in Nigeria, and I was saying that for people that go through or have children that have autism, that's the parents, they might need support because information is not readily available to them past the experience. So I was asking, is there something like a support group for parents of those who have children that are autistic, then also support for the children themselves, because at the end of the day, they grow up. So they have like a support group where they can all be together, learn, advise each other and all that. Yeah, that's
okay, I think, sorry, because I must have misread your question, because I think I answered that on the chats as well. There is an association called the Autism Parents Association International, and they are based in Lagos, but they are national. So they have a WhatsApp group, and they also have a Facebook page. And Angela Imua is the president of that group. So I mean, if you Google Angela Imua, you then find out who she is. So I'm not going to go into that now. So they do parent forums on a regular basis. In fact, they did one a couple of weeks ago, which was a virtual hangout because of COVID, obviously. Before COVID, they actually do meet up physically at a location, at a given location. On the WhatsApp group, because I'm part of that WhatsApp group as well, I try and offer advice sometimes or what have you. But I also know that many parents that live in various parts of Nigeria would always ask questions like, where can I get a speech and language therapist or an OT for Abuja or for Oshogo, everyone tends to answer. They answer those questions because you have there a lot of parents who also have, I have to say, a lot of parents on that forum have a wealth of knowledge about autism. In fact, some of the things that I come across that they read and the research that they do, because some of them are high-powered professionals as well. And we also have parents who are still seeking advice from professionals or parents like us as well. So it's a good mix of people. So I would recommend the Autism Parents Association International. If you do a search for them on Facebook, you'll find them there, and they might then put you on the WhatsApp group as well. But you definitely have you definitely be able to join them on the WhatsApp group if indeed the on the Facebook group, if the WhatsApp group is not oversubscribed already. That's the only one that I know of that I know functions as well. There's a national autistic society in Nigeria, but I have not been able to see any signs of what it is that they do. Please, I'm not going to sit here and say they don't do anything, but what I can say is I haven't seen any form of in your face, if you like, kind of proactiveness. I haven't seen that, but the APAI, they're very proactive, and they do a lot of functions for parents. Does that answer your question, Tommy Singh?
Yes, it does. Very well. Okay. Very well. Thank you very much.
All right. So if you want that information again, I can give it to you later. All right. I don't think I saw any more questions, but if anyone, we can take a couple before we say goodbye. And I just have one or two more things to say, which is not going to take long at all. But if I can't see any more. Okay, people want to share his contact details. We'll have that. Now, let me put that up here as well, because I did have a slide that had, yeah, okay. So let me share my screen. So you can now get Sheyi and Joyce's contact details. All right. Here, share. Okay, Joyce, I didn't have yours in the end, but we can always give it. Joyce. Oops.
I'm here.
Yeah, I forgot to put yours on in the end, but we could always give it later.
Yeah, that's fine.
Yeah, so you've got Justice Place Foundation there. You've got our website where you can always contact us through the website, and that would come straight to the email address as well. You've got Sheyi's email address there, oluwaseyi@gmail.com. Joyce's email. Joyce, do you want to verbalize? Just say your email address.
Yeah. So my email address is handsofjoyconsulting@gmail.com. I'm going to put it in the chat as well. handsofjoyconsulting@gmail.com.
Okay. And everyone should have Justice Place Foundation's email address because it was on the flyer as well. So I hope that is okay. And I also wanted to say that everyone who's joined the forum today, and even those ones who asked for registration and asked for the Zoom link, I've put you all on a mailing list. So which means subsequent programs that we have, you get to know about it firsthand and you can share with other people as well. But please, because of GDPR and all that, especially in this country, if you don't want me to keep your details on the on our database or on our mailing list, just send an email to justiceplacejp@gmail.com and I'll take you off. But what I've done is I've managed to get everyone's details on one platform so that I can just press a button to email you all when we have any programs or anything that I see that I think is important and valuable to you as parents, carers, or professionals. I'll just send it to you straight away. So that's about it, everybody. So thank you very, very much for coming. Thanks for your patience. Thanks for being a wonderful audience, and thanks for your appreciation, because I read a lot from the chats. And thank you, Sheyi, for all you do and your consistent passion and your commitment to our people with disability in Nigeria, especially in Ogun State. Well done for that. There's only God that can continue to empower and bless you in that area. And Joyce, Amen. Thank you for all you do too, for your passion, for your hard work, and for your commitment. Thank you, you two, for coming on, and thank you, everybody. Thank you. So I'll have to say we'll say goodbye. Thank you.
All right, bye.
Bye-bye. Bye-bye. Oh, and just one thing I wanted to say. I'm going to put the program, the recording, on Justice Place YouTube channel.
Oh, beautiful. Oh, that's good. You can get it from there. Okay.
Okay, and I'll send you an email to let you know. I'll send you an email.
Hi, Shay. This is Dami saying hi.
Thank you, Shala. Say hi to your son.
Thank you. Thank you.
Hi.
Bye-bye. Bye-bye. Bye, everybody. Bye.
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 Hi to Rosie.
Thank you. It was nice. Thank you. Dami, bye.